Next, I would like to introduce Dr. James Wong, who's our chairman of the Department of Radiation Oncology and the medical director of the Leonard Kahn Head and Neck Cancer Institute.
Ladies and gentlemen, community leaders, Dr. Trish O'Keefe, Dr. Eric Whitman, Lydia Ladau, and members of the foundation of the Leonard B. Kahn Foundations. Thank you all for coming to this wonderful opening event. We would like to give special thanks and credit to Trish O'Keefe, who has been a very strong force behind the scene regarding the development of this HPV Center. As director of the Leonard Kahn Head and Neck Cancer Institute and chairman of Asian Oncology, I'm especially happy and personally touched by the inauguration of this HPV Center. 5 years ago, when Mr. Kahn believed in us and charged us with the formation of the Leonard B. Kahn Head and Neck Cancer Institute, we knew it would be successful. But its growth was beyond our imagination. It is now the most successful and busiest Head and Neck Cancer Institute in New Jersey. The founding of this HPV Cancer Center is its crown jewel. Recently, I did a Google search and was not able to find a single dedicated HPV Cancer Center in US or in the world. So we may be the first dedicated HPV Cancer Center of its type. Mr. Leonard Kahn, you must be smiling up there. I'm sure that many of you have heard about HPV or human papillomavirus causing cancer. We are told by medical experts that many head and neck cancers in the oropharyngeal regions, such as the tonsil or basal tuft, are related to HPV. These viruses are acquired through intimate contact or via body fluids. Many people who are asymptomatic can have this virus found in the saliva or other bodily fluids. Hence, they may spread the virus unknowingly. Celebrities such as Michael Douglas, in his own interview, revealed that he developed HPV-related throat cancer. Now, I will share with you some of the facts that we know about HPV. 80 to 90% of all people in the United States have at one time or another been infected with one type of HPV or another. So you do the math, 250 million people in the United States have been infected. Each year, about 1 of 10,000 such infected people will come down with oropharyngeal cancer, which means that 99% of patients or people who have ever been infected will not come down with the cancer, even though they've been infected in the past. Only 15% of such patients have, the oropharyngeal cancer patients have substantially more intimate contact partners than the general populations. This means that the other 85% do not do anything different than the general populations. The risk factors for developing cancers are highest in white 40 to 60-year-old male with high incomes and high educations, such as MDs, MBAs, or lawyers. One of the few times that higher income and higher education is bad for you. Bill Gates, Elon Musk, and Mark Zuckerberg, watch out. For this high-income Caucasian men in their 50s, they are actually not the group with the highest oral HPV infections, and yet they have the highest incidence of HPV-associated cancers. For example, non-Hispanic black males have much higher oral HPV infection found in the saliva than white males, and yet they have a much lower incidence of HPV-related oropharyngeal cancers. Male outnumber female 4 to 1 in terms of HPV-related oropharyngeal cancers. Hispanic and African American female have a relatively high incidence of HPV-associated cervical cancers, and yet they have a relatively low incidence of HPV-associated oropharyngeal cancers. Well, there are also HPV-associated cancer in the nasal sinus and in the larynx. So, although not common, it always puzzles me. How in the world did the HPV virus go to the sinus behind the nose and cause cancer there? Some type of intimate contact. Or maybe the virus just traveled through the lymphatics or the bloodstream to get there and cause trouble. Well, I'm not going to steal Dr. Huygens' funded here, but if only 1 to 2% of patients who are infected with HPV comes down with oropharyngeal cancer, does that mean that our body have a way of getting rid of these cancers or preventing from happening in the first place? If we can figure this out, it may be the best way for cure. It is because some of these points that I mentioned that in our team of experts in here, in addition to the one that you see, we have Dr. Renee Franco, a renowned infectious disease expert, and Dr. Lisa Bariciano, a renowned immunologist. They may help us some of these problems. I'm a radiation oncologist, so I must tell you that radiation therapy is very important for the treatment of HPV cancers. Whether the patient is being treated with surgery or chemotherapy, over 90% of such patients will still need radiation. And the good news is that 90% of them will be cured. We are now actively decreasing the intensity of radiation in order to decrease the side effects. Because the HPV-related cancers are very radiation sensitive, meaning that they shrink fast with a small amount of radiation that we give. One of the ways we do it here that's different than other centers is that every 2 or 3 weeks we make our radiation field smaller so as to minimize the side effect of radiation to the adjacent normal tissues, because the patient will be cured. Therefore, the quality of life of treatment in the future is very important. All of us here at Atlantic Health System believe that treatment of cancer is more than just getting rid of the cancer. We must make the patient and his or her family have the least disruption of their life. And I'm very honored to be a member of this group. The community, the hospital, the staff, and the patient. We are all traveling together in this very exciting journey to conquer the HPV-related cancer. Thank you very much for your attention.